Hello, my name is Dr. Padula, and I want to tell you about a new drawing design that I've created for vision therapy and neurooptometry. It's called the Padula Diamond Drawing, or Visual Spatial Drawing Test. It's on a simple form like this, similar to that which is used for the VO star drawing. And it has 3 horizontal lines, and within this pattern, you can test for pursuit tracking, saccadic fixations, binocularity, as well as fusion and the ability to organize visual spatial time and movement. There are 2 different forms, one of which has the 3 horizontal lines, and the other has 2 diagonal lines that will enable you to analyze binocularity for orthophoria, esophoria, and exophoria simultaneously and dynamically while the person is drawing. I'm going to take the time now to show you a series of drawings and how patients use these. Start by placing the diamond drawing chart into the gyroscope or stereoscope. Ask the patient to view through the stereoscope, and what they will see are 3 horizontal lines, each line stacked one above the other and spaced. Ask the patient now to raise a pencil from both hands to the center line and hold the pencils like they're going to write or draw with them. Placing both pencils on the center line, bring the pencils to each other until their points appear to touch. Have the patient draw a dot or circle easily seen by both eyes. Then have the person bring both pencils to the top line where the pencil tips still appear to touch and directly above the dot that they drew on the center line. Instruct the patient now to draw both pencils down and to the left so the pencil tips continue to touch. Have them draw the lines diagonally until they touch the center line. Then have the patient bring the lines back down to the right, trying to bring the pencils to touch directly below the dot that they drew. Following this, they draw the pencils up and to the right until they touch the center line, and then back up to the top until the pencils meet on the top line, and have them draw approximately 5 to 10 diamond drawings, one over the other. As they do this, they may report one pencil disappearing, indicating that one eye is being suppressed. Have them touch the pencil to the page that is disappearing so that they can feel that pencil touch the page. This will usually reestablish the image. As they draw, if you see one eye starting to deviate, the diamond may start to drift inward, showing that a state of esophoria is happening and that one eye is starting to lose binocularity. If one of the diamonds or both of the diamonds drift outward, this would be a case of exophoria produced. You'll see considerable variation of the drawings depending upon the binocular state of the patient that's doing the particular activity. In this test, what we are doing is establishing fusion on the pencil tips and also pursuit tracking while maintaining spatial orientation of the drawing around the initial dot. Have the patient stop and then analyze the drawings. In this case, you can see how the right diamond began to drift inward, indicating a state of esophoria. Even the left diamond was started to be projected inward. For a second drawing, we're going to start the exact same way by having the patient place both pencils on the center line, making a dot where the pencil tips appear to touch and are integrated or fused. Now we're going to have the patient go to the top line and draw the diamond in the opposite direction, down and to the right. This can also be accomplished by providing the patient with a metronome, asking them to maintain a certain value of auditory timing as they draw the diamond and the lines of the diamond around the central fixation point. In this task, we are asking the patient again to view the tips of the pencil and draw the lines around the centration dot. The testing can also be done with a central steady gaze fixation on the dot and asking the patient to draw the lines around the central dot, similar to that which would be done on bilateral circles when drawing on a whiteboard or chalkboard for vision therapy. A metronome beat can also be used on this with central fixation, as well as with fixation on the pencil tips. As the patient is drawing, you will again notice that this situation is developing a tendency toward esophoria, where the diamonds are drifting together. And we'll stop at this point. On this diamond drawing chart, you'll notice that two diagonal lines are presented to cross the center midline. In addition, there's also numbers in the periphery that are similar to the star drawing task. Let's use the star drawing task initially with the diagonal lines. First, start by asking the patient where the diagonal lines seem to intersect. Place both pencils where the diagonal lines are intersecting. The patient is representing the diagonals are crossing or intersecting beneath the horizontal line. This would indicate esophoria. The further down the lines bisect beneath the horizontal midline is an indication of a higher amount of phoria. If the lines bisect above the horizontal line, this would be a case of exophoria, also indicating the degree of exophoria, the higher the lines intersecting above the horizontal midline. In this case, we're not going to ask the patient to place a central dot, although this is possible, but we're going to ask the patient to take the right pencil and place it on the top right number and the left pencil on the bottom left number. In this situation, we're going to be working with saccadic fixations, looking back and forth between the two pencil points and asking them to draw these lines of the pencils directly toward each other until the pencil tips touch, and this should happen on the horizontal line. And we're going to ask the patient again to move to the number 4 above and below the initial line that they drew, and to repeat this. It will continue drawing until the entire star drawing is completed. As the patient draws this, you'll notice that the lines are being projected inward and closer to a center point beyond which the horizontal line has a bisection from each diagonal. This is an indication of a slight amount of esophoria, mostly projected at this point by the left eye. And the final product demonstrates a slight tendency toward esophoria, and we're noticing that the left eye is the point of deviation. On this task, what we're going to do is ask the patient again where the diagonal lines appear to be bisecting. Again, the patient is showing a slight esophageal. We may ask the patient to put a dot at that point, but in this particular task, I'm going to ask the patients to just simply bring the pencil tips to the top horizontal line directly above the bisection point of the two diagonal lines. We're now going to accomplish the diamond drawing test in a similar manner to that which we did initially. So the patient will draw the pencils down and to the left until they touch the horizontal line, then angling down directly to the bottom line beneath the point of intersection of the diagonals, back up to the right to the middle horizontal line, and then eventually diagonally projected to the top line. And we're going to ask the patient to do 5 of these drawings. If one of the pencils disappears, we're going to ask the patient to tap that pencil against the page to see if we can initiate vision established in the eye that was being suppressed. Now stop at this point, and we're going to ask the patient to bring the pencils to the point of centration or integration of the two diagonal lines. And I'm going to ask her to make a dot with both pencils there. And you'll now see what occurred as she went through this task, and she became more esophoric as she fixated. Having the patient with the diagonal diamond drawing test again, I'm going to ask the patient to show us if she can bring the diagonals to be intersected on the horizontal line. And she's indicating yes, she can. However, there is still a state of latent esophoria produced, and this could be a case of overprescription for myopes. So I'm going to ask the patient to remove her glasses. When looking into the chart now through the stereoscope, where do the lines, diagonal lines, appear to integrate? And she's indicating now that the diagonal lines are now bisecting on the horizontal line. This would be a case where I would strongly believe that there's a case of over-minusing or over-prescription of a myopic prescription. So I'm going to ask her to remove her glasses now and to bring both pencils to the top line. And we're going to continue doing the diamond drawing just as she did initially. But I'm going to ask her to monitor where the diagonals are bisecting. She's indicating right on the horizontal line. So you can begin. Are the diagonals still being maintained? No, they moved down into an esophoric position. Okay. Bring your pencils to the top line. I want you to look at the horizontal line. Can you bring the diagonals to intersect on the horizontal line?
I can get them close. Right here.
I want you to look at the intersection point this time. And instead of drawing a diamond, what you're going to do is bring both pencils to the top line And you're going to go in opposite directions while you look at the intersection point of the diagonals on the horizontal. So you're going to move both pencils out and down, trying to maintain the alignment of the diagonal on the horizontal. Now down to the bottom, directly beneath where the diagonals are bisecting. Now, instead of crossing over, I want you to go back up in the same direction and train the binocularity to be maintained to reduce the euphoria. When you get to the top line, I want you to bring both pencils back to the center line where the diagonals are touching on the horizontal line. Okay. And bring your pencils down. In this training session, I was working with her to establish steady gaze fixation and peripheral fusion to integrate the two diagonals onto the horizontal line. And she maintained the alignment of the eyes while she was drawing the outside portions of the diamond.